family, and it's really great to see people from all over the country that came here today because it brings back such memories of the community that we have, the single-payer community, the people that fight for healthcare justice. I want to thank Sue and Donna for making this a possibility, and let's give us a round for Sue and Donna. And making it so simple, duh.
Yeah.
Demonstration for universal healthcare. It can't get much simpler than that. So I'm just going to say a few words and then Kevin will speak. So we're celebrating this week the 50th anniversary of Medicare. And Medicare was meant to be a beginning. It was meant to be expanded to the rest of the country. That was the intention. Instead of that, 50 years later, what are we seeing? Medicare is being dismantled. It's being privatized. And I have to say that both the Republicans and the Democrats are trying to privatize and dismantle Medicare. You just need to look at how Medicare Advantage has grown since the Affordable Care Act was passed in 2010. We're continuing to see tens of millions of people without health insurance. We continue to see tens of millions of people who have health insurance, but they can't use it because of the restricted networks, the now ultra-narrow networks that mean they exclude all of the health centers that people would need to go to if they were actually sick. Because of the high out-of-pocket costs, which even though they capped them, in this economy, people still can't afford to get the health care that they need. So our fight continues. We have to understand that the ACA is a traditional neoliberal model of healthcare, a market-based model of healthcare that is destroying our public health systems, funneling public health dollars to the tune of hundreds of billions of public dollars directly into the hands of the private insurance corporations. And it means austerity upon us when we can't get the health care that we need. So we need to be clear, because we're told that single payer is a path, that the ACA is a path to single payer. But if we look at the news recently and see that Anthem is now looking at buying Cigna if United Healthcare doesn't get there first, and that Humana is buying Aetna, that wasn't the single payer system that we were talking about. We're not looking for a single private health insurance monopoly, because we know what that means. It means that prices continue to go up and that we continue to not get health care. We see it in the pharmaceutical industry. Now that the pharmaceutical companies are buying up the generic companies, prices of basic medications that we need, like doxycycline, are going up by thousands of %. I had to get a prescription for my dog the other day for doxycycline. It used to be a couple of bucks. It was over $100 to get that for him. What are our patients going to do in that situation in this economy? So we have to be very clear. One thing I learned during the healthcare fight in 2009-2010 is that we have a healthcare crisis and we need the ICU. And that stands for independence. We have to set the agenda independent of the political parties. We can't follow their agenda if it's taking us down the wrong path. We set the agenda. We have to be clear about what that agenda is, because the propaganda tells us that the ACA is universal, affordable, and guaranteed. It is none of those things. We have to understand that single payer is the smallest increment of change that we can make to go in the right direction. And we have to be uncompromising. No longer are we going to say, we'll accept this little piece because maybe we'll get more later. That has continued to take us down the wrong path. So independent, clear, and uncompromising in our demand for single payer. And we have to understand that single payer is part of the broader struggle for social, economic, racial, and environmental justice in this country. And as Dr. Stein said, when we come together, we are an unbeatable force that can change the political will of this country. And that's what it's going to take to overcome these industries. So with that, I'm going to pass it off to my partner, Kevin.
Thank you. Thank you all for coming out. I have one message, and I'm going to be brief about it. The message is unity. Unity. We are all connected, not just because healthcare affects all of us. We all are born, we all get ill, we all die. Beyond that, we have a very fragile reality in the United States when it comes to healthcare. As Jill mentioned, our food supply is corrupted by big business. They want to hide from us the reality of GMO foods. They don't want us to know what we're eating. We all suffer from the same environment, the toxics in the environment, the pesticides massively used, the air and water pollution from fracking and other carbon industry. We all suffer from the same climate change crisis. We are all connected. And we have to act in unity, recognizing that fighting for health care to get what we want requires a radical transformation of the United States. A radical transformation, not just on health care. Not just on health care. We will only win the health care battle when we unify to challenge the corrupt system of the economy and government that we live under. And I say under because this is an oligarchy. It's a mirage democracy with rigged elections, and we get hypnotized by the media that puts out the elections on a day-by-day basis, having a poll fight now. Almost 2 years from the election, 9 months, 8 months from the primaries. I know many right now are focused on Bernie Sanders. Frankly, I think that's a mistake. Who voted for the ACA? Bernie Sanders did. Who voted for the ACA? Donna Edwards, held up last week as a champion of single payer. She left the single payer fight almost immediately when the ACA began. How can we trust her when she runs for the Senate? Even John Conyers, the lead sponsor of the single-payer bill, left us because of his partisan politics, and then lied to us and repeated the lie over and over again that the ACA, that Obamacare was a step towards single-payer. That is such an obvious lie. It's the reverse. We're going in reverse. There are many issues that unite us. And they challenge the system of privatization, the system of deregulation, the system of neoliberal economics that promises us austerity and promises big business wealth. One of those battles that is right in front of our faces right now that we have to unite on is stopping the Trans-Pacific Partnership and other of these Obama trade agreements. These trade agreements will undo Medicare. They will undo Medicare. They will undo single-payer programs around the country, around the world. We're seeing right now this weekend, we saw in Hawaii at the negotiations, they were unable to reach agreement. One of the key reasons was because the Obama administration is pushing immense profits to the pharmaceutical companies, requiring evergreen patents, doing away with the power of generics, requiring that all sorts of health services are privatized and commodified. The countries that are saying no are the single-payer countries around the world who know that if that becomes reality around the world, their systems will be destroyed. They are the shining examples of what's right in the United States, and it's bullying, neoliberal, vicious capitalism is forcing these countries to destroy their own healthcare when they have healthcare that works and we have healthcare that doesn't. Now, this is a tremendous opportunity, the Trans-Pacific Partnership, because it's an opportunity for us to change the political culture in the United States. It's a culture currently dominated by the idea of privatization and markets rather than social good and human rights. We have the chance to change that. But as I said, the one word I want to leave you with is unity. Because the only way you're going to fight these tremendous transnational corporations that are unified, pushing for the TPP, for the TAFTA agreement with Europe, for TISA, the Trade and Services Agreement, that will privatize not just Medicare, but our postal service. Everything that's working from the government will be privatized by these Obama trade agreements. We have to unify around this as an opportunity to change the political culture of the United States. If we stop these trade agreements, we are stopping the neoliberal economy. We're stopping privatization. We're changing the direction of the country towards social good and human rights. And that is the mentality we have to have. We need a government that puts people and the environment before profits. Right now we have a government, and when they're bipartisan, they're at their worst. We have a government that does the opposite. It puts the profits of their donors ahead of the necessities of the people and the protection of the planet. It's our job to reverse that, and the only way we're going to do so is in solidarity. So please, if you're not a part of Popular Resistance yet, I urge you to visit the website popularresistance.org and sign up, because we are organizing a broad coalition to stop these trade agreements and reverse the direction of the political zeitgeist of this country. So go to popularresistance.org, sign up, and get involved in this TPP fight. It's probably going to happen next year during the election year, and it's a tremendous opportunity for us to spotlight the misdirection of the country and begin that radical transformation that is essential for us succeeding on this issue and on so many others. Thank you all very much for coming out.